What if I told you that a life-threatening pregnancy complication can be predicted? That's what Nina Sesto is making possible. And if you're a US health insurer, watch till the end. At Superconnectors, we tell impactful founder stories and use our networks to help solve their biggest challenges. Let's zoom in on the US, where maternal mortality is 4 times higher than in any high-income country. Reason for that? A sudden heart disease called preeclampsia, which often leads to emergency C-sections, severe complications, and even death.
Preeclampsia is a condition that even clinicians describe is happening out of the blue. Within 6 hours, her system is falling apart, she's rushed into an emergency, they're literally saving her life.
Such complications lead to $20 billion in costs for US payers every year, because 1 in 5 affected babies, the so-called million-dollar babies, start their life in the ICU. But according to Nina, this is more predictable than clinicians realize.
There is not such a thing as a sudden thing in your biology, There are signs and symptoms way ahead that, you just don't pick up.
Nina did not experience preeclampsia herself, but she lost a close person to a sudden heart event, which made her question, how can we prevent others from the same fate? So together with her co-founder, who also lost a close one to a preventable disease, she founded MEGI, an AI-powered care platform that analyzes self-reported metrics to flag early warning signs in women's cardiovascular health. Starting with preeclampsia. MEGI is Nina's way of giving women that feeling of safety when every irregularity in their body becomes a reason for concern. Its proven high effectiveness opens doors to predicting other diseases as well. And the time to act is now.
There is the whole movement on the US market around the maternal health because it's so expensive and, that's why we moved now to the US.
Nina's critical ask is an introduction to leaders in the US insurance space who can champion MEGI for early trials, evaluate it for coverage, and unlock care for women whose access to it is limited. If you know someone who can help, this is your time to become a Superconnector. Tag them below.